Hello everyone, I am Dr. Mohammed Hamza, consultant pathologist working in NASA hospital. Now we will be discussing about what does a CBC test. CBC is nothing but complete blood count test investigation. It is a simple blood investigation routinely done, commonly done to assess various parameters, and at the same time it is very useful and very important blood test. So the CBC includes three main parameters. So one is RBCs, nothing but red blood cells, then we have WBCs, white blood cells, and then we have the platelets. So these are the general categories of the blood elements which can be detected by a simple CBC, that is nothing but complete blood count. So RBC, what tests include is the RBC count. So the RBC count generally is around 3 to 4 million per cubic. So the less number of RBCs means the patient is having anemia. Another one, the main test which comes under CBC is nothing but hemoglobin levels. So the normal hemoglobin level for an adult female will be more than 11.5 grams per DL. Then for males it will be more than 12.5. So if the person is having less hemoglobin in the form of less than 11.5 in females and less than 12.5 in males, so that means the patient is having anemia. So the patient is suffering from anemia. Okay, so now coming to the different types of anemia, we'll come back to it later. Next we have WBCs. WBCs are nothing but white blood cells. Okay, the normal WBC count in healthy adult will be 4,000 to 11,000 cells. So if it is lesser than 4,000 cells, then we call it as leukopenia. So what it means is there is not enough WBCs which are ready to fight for against the infection. And if the counts are very high, if the WBC count is high, somewhere in the region of 20,000, 22,000, that means the patient is having active infection in the body, and the patient is the WBCs are fighting against the infection. Then we come to platelets. Platelets are the important cells which are required for the bleeding, to control bleeding. So the normal platelet count will be more than 1.5 lakhs to 4 lakhs. So if it is less, then it means the patient is having thrombocytopenia, so which are seen in different conditions. The most common condition will be like in dengue fever. Okay, so when those counts are high, and based on the severity, the number of less than 1.5, if it is less than 1, it could be mild, but if it is less than 50,000, it could be severe, and the patient could be having active bleeding from GIT or gums or from any trauma. So generally platelets give a assessment of bleeding control. So then we have different other parameters like in the form of PCV. Then we have certain blood indices which will tell the different types of anemia. So we have MCV, MCH and MCHC. So what MCV tells us, it is nothing but the average volume of the RBC. So the normal size of the RBC. So if the patient is having less than as I told you 11.5 in females and 12.5 in males, so the person is having anemia. Then we can get an idea as to categorize the anemia based on MCV levels. If the MCV is lesser than the normal value, then we can call it as microcytic anemia. So the common cause for microcytic is nothing but deficiency of iron. Iron deficiency is the most common cause in India, causing microcytic hypochromic anemia. And similarly, if the MCV is more than the normal value, then we can categorize it into macrocytic anemia, where the MCV is higher and the patient is having less hemoglobin, that is anemia. So that time we call it as macrocytic anemia. The common cause for which is B12 and folic acid deficiency. Okay, then coming to the WBCs and platelets, I already told you these are the important parameters which can be assessed in CBC.